Hi, I'm Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. I'd like to welcome you to our latest series of the National Telehealth Webinar Series. As you can see by our map here, we have actually 14 different telehealth resource centers across the nation, or TRCs as we call ourselves. The Upper Midwest Telehealth Resource Center that I represent covers the states of Illinois, Indiana, Michigan, and Ohio. Each month we do have a different presenter and a different TRC hosting this presentation series. We ask that you fill out the post-webinar survey that we will put out at the end. The recordings will be posted on the National TRC YouTube channel. You can see that link there, and I will send it out to you again at the end of today's session. Your phone or computer microphone has been muted. You can use the Q&A function to ask questions. And with that, I'm going to go ahead and introduce our speaker for today. Our topic is telepharmacy. We're talking about what you need to know about telepharmacy, and our speaker today is Greg James from Telepharm. So let me go ahead and pass remote control. All right, Greg, take it away.
Thanks, Becky. I'm not sure. I want to make sure that I have the ability to take this all requested as well on this side. So first of all, I just want to thank Becky Sanders and the Telehealth Resource Centers. They've been instrumental in helping provide us with a lot of opportunities to connect with people here in the industry and across the country. So if you haven't really utilized the Telehealth Resource Centers before now, I'll give you a quick plug that everybody should definitely utilize them. They're great. They're great ways to connect with other people in the industry and to really push telehealth forward in a lot of different ways. I have with me, I invited a couple of people on our team. I have Zach Schledetsky, who's also does some of the marketing communications here at Telepharm along with myself, and then Adam Chesler, who is our regulatory expert when it comes to the outpatient retail side of telepharmacy. And he's here. He might hop in and say a few things, but also for reference for anybody throughout the period and then afterwards during questioning, if you have any specific questions on regulations or state laws, he's a great resource. We latest and greatest. So if I get out of order, my apologies, and have a new presentation. So getting things started, what I'll do is I'll run through a few of the slides that we have, and then we'll be taking questions through the chat. And at the end, I think like Becky said, she'll kind of wrap things up, and then we'll have a chance to talk between all of us and answer any questions that you have. Anyway, the first question we get start talking about telepharmacy. There's a couple other people who are on the call who are very familiar with telepharmacy as well. As you know, what exactly is telepharmacy? What do you think about when you hear this word telepharmacy? And I hope I'm not breaking up here. I think Becky's just the question we want to make sure that we're all talking about. You know, it's pharmacy through a telephone, or it's thing just for inpatient, or there's a lot of different ways that it can happen. Breaking up here. Let me see if I can do anything about that.
Okay, I think Greg is having a little trouble with his computer, so I'll kind of jump in and try to do the best to take over as best I can. Can everybody hear me all right? Okay, perfect. So we'll jump through this, and one of the first questions everybody says is, what did you hear of when you first thought about telepharmacy? What's your first impression? And a little bit about me, I'm a pharmacist as well, and when I first heard telepharmacy, to be honest, it scared me a little bit. I thought, this is the end. This is where all the pharmacist jobs are going to be taken. This is where they're all going to go. This is the beginning of the end. But as I started to really look into it and started talking to the team over here at Telepharm before I joined, I started realizing it's kind of the beginning. We look at some of the biggest problems we're having as pharmacists, and it's providing access to a pharmacist in the areas where we want to be able to provide access. And you'll see throughout this presentation, you'll start to really see telepharmacy is kind of creating jobs. It's creating access to a pharmacist. It's allowing pharmacists to be in places that we weren't able to be before. And overall, kind of highlighting our ability to take care of the patient, to showcase health, and really shows what we can do for patient adherence. So we'll kind of slide through here. There's really four main types of telepharmacy. The first type of telepharmacy that you really hear of is remote order entry, and a lot of people are doing that currently. That's that first order entry when you're really reviewing the prescription. We call it PV1. The data gets entered. The data gets checked by a pharmacist. It could be at one site. It can be at multiple sites just to make sure everything's correct. And it's really sharing of that responsibility. There's IV admixture, which is what they're doing in hospitals, where they'll be verifying what's being checked at overnight hospitals, rural hospitals, to make sure that the patient is getting their inpatient medications that are correct. There's retail telepharmacy, which is remote dispensing, which is what we're going to highlight mostly here today. And that's having that telepharmacy kiosk, not necessarily a kiosk, but having a remote site. And this is where we kind of get tricked about telepharmacy. It's not really a telepharmacy, but it's more of a remote pharmacy, where you're really the pharmacist doing everything that they were doing at a other site, but they're doing it from a distance, being able to review that. And then there's remote counseling as well. And that's really just that MTM therapy management can be considered that. That's being able to just have a tablet in areas where you're able to counsel patients, talk to patients, be able to follow through with those types of things. Let me figure out how to switch slides.
Adam, you should just be able to use your up and down arrow keys. I think I've given you a remote control, or you can request it.
Okay.
There you go.
Look at that. All right. Still moving through. So today we're going to really talk about telepharmacy in a big scope. It's what are the three main benefits of telepharmacy? And it's number one, to utilize technology to improve patient adherence. Number two, allow pharmacist access in rural towns or areas that don't have pharmacist access. And number three, increase that pharmacist outreach. We're talking, when I mentioned that telepharmacy really is creating jobs, it's really where people kind of argue until they start to think about it. When you provide that pharmacist access and increase that pharmacist outreach, it's really creating the number of jobs that pharmacists can have and increasing them. Before I dive into that, we'll talk about where telepharmacy came from. Why are we talking about telepharmacy today? If you look between March 2003 and December 2013, about 924 independent rural pharmacies closed. 490 rural pharmacies lost, or rural communities lost their only pharmacist. So that right there is kind of alerting. It's really scary to think that all these independent pharmacies are closing. When they're trying to close, they're not able to find somebody to buy them. We've had stories of pharmacists who wanted to close their pharmacy, they wanted to retire, but they left their pharmacy open because they couldn't find anyone who wouldn't buy it just for the records. You know, they wanted to buy the pharmacy, shut it down, and be able to make the patient transfer all their records. Still trying to click through here. And this all started back in 2001 in the United States with the North Dakota Telepharmacy Project. The North Dakota Telepharmacy Project, when telepharmacy again first started, it was just live video. And that's what these pictures are really portraying, and how the Telepharmacy Project really worked. A pharmacy technician stood in front of a camera and filled a prescription and held it up. The pharmacist got in front of the camera on the other end and said, "That looks right." The patient filled the prescription, or the pharmacy technician filled the prescription. The patient came to pick it up. They got in front of the camera. Pharmacist got in front of the camera as well, and they talked to each other and did their consultation, and then the patient left with their medication. And just me describing it to you right now, you can kind of tell that it's obviously not the best way to go about practicing pharmacy, but it was a way. It was a solution. There's patients who don't have access to care, and we really needed to make sure they had access. The interesting thing out of this North Dakota telepharmacy project, and this is what really blew me away when I saw it, there were 28 hospitals and 53 retail locations involved in this study. And I had no idea between 2002 and 2008 that 81 telepharmacies were even operating. To be honest, and no offense to North Dakota, I had no idea there were 81 pharmacies in North Dakota between 2002 and 2008. But there were 81 pharmacies involved in this study, and that's not a bash on North Dakota. I love North Dakota. But it's more a realization that telepharmacy has been going on for a very long time. And out of this study, it showed that there were less than 1% of errors in telepharmacy, and that was the way it was being performed with live video. The national average at the time was about 1.7%. I wouldn't sit here and say that there weren't other factors at play. I guarantee you the pharmacists were more careful at a telepharmacy. They knew this going in. They were extremely careful with what they were doing. But I think the study shows that telepharmacy can be practiced at least as safely as traditional pharmacy. We look at other states that do telepharmacy, and even other countries. Australia provides 90% of the population in Australia lives in 10% of the country. I like to talk about that because it's interesting to me, but everybody lives on the coast of Australia. There's that whole area in the middle there that almost nobody lives. And they practice telepharmacy at a significant rate in those rural areas. They even do it from an airplane, where they fly an airplane out to these patients, treat them, and then they'll call a pharmacist up on the phone. And that's kind of the tele concept fully really there. But Alaska does telepharmacy. They've been doing telepharmacy since about 2003. We've been told stories of telepharmacies in Alaska where they open the pharmacy when a patient calls. So these towns are so small and so remote that the only time they go into that pharmacy, they'll get a phone call and they'll drive over there, open the pharmacy, dispense the medication, and drive home. Minnesota, I like to talk about Minnesota as well. They started in about 2005, and if we want to talk about how far technology has come, Minnesota used to consider store and forward technology as you would take a picture of the prescription and then fax it to the pharmacist at the other location so they could see what you filled. And that's kind of the birth of store and forward technology. And you can only imagine what those faxes looked like back in the day. But when we start thinking about patient access and patient need and patient outcomes, we really try to do whatever it takes to make sure the patients are taken care of. And the U.S. Navy is actually the largest user of telepharmacy in the country. If you think about they're spread all over the country, battleships, carriers out in the middle of the ocean, how do they get access to a pharmacist on these if they don't have one on board? And they are the probably world's largest user of telepharmacy. So we talked about telepharmacy from 2002 to 2008, and you can see on this map how many states were looking at telepharmacy or had some kind of telepharmacy rules in place in 2008. Fast forward to 2016, and the 2017 map that we're probably going to put up is going to be even larger. My main job right now is regulatory affairs for Cardinal Health, dealing with telepharmacy only, and it's become more than a full-time job. Telepharmacy is becoming a very hot topic in these states. People want to review it, and even this map is a little misleading because it varies wildly across the board. Which states allow what they allow. You look at Tennessee, and it's on here as blue, but Tennessee only allows telepharmacy in a federally qualified health center. And you look at Illinois, and they're blue, and you can do telepharmacy on the roof of a Walgreens if they'll rent you the space. And some of our best customers that do telepharmacy are located in Illinois, and that's really where we'll start getting into our third point about allowing telepharmacy in the south side of Chicago, not just in rural areas. So how can telepharmacy really help improve medication adherence with patients? When we look at telepharmacy and really patient adherence in general, 187 million Americans take more than one prescription. And then when we kind of extrapolate that out into healthcare expenses, $290 billion every single year is estimated to be lost due to non-adherence. And that's just avoidable costs from patient non-adherence of not taking their medications. $290 billion, which is 13% of the overall healthcare cost. why is this so, and where can pharmacists really help on this? We like to reference the leaky bucket study, which was put out by IMS. You take 100 new prescriptions, 50 to 70% of them arrive at the pharmacy in the first place. So these are patients that are discharged with prescriptions. Only 50 to 70% of them fill them in the first place. 48 to 66% of them are ever even picked up. So they'll drop them off. They never pick them up. Out of that, 25 to 30% of them are even taken properly. And then out of those patients, 15 to 20% of them refill them as prescribed. So they call it the leaky bucket, but for every 100 new prescriptions, only 15 to 20 of them are actually refilled as prescribed, and only 25 to 30 are taken properly. But I like to look at this from the pharmacist standpoint and from an operations standpoint. Let's look at it backwards and see, how can we fix these things? How can we make patients refill their prescriptions as prescribed? We start doing patient adherence calls. We'll call them, remind them, let them know that their prescriptions are ready. We send them text messages. We do emails. We let patients know that their prescriptions are ready to be filled. How can we ensure patients are taking their medications properly? We do brown bag events. We do counseling. It is basically the main thing we do, but we talk to the patients as pharmacists. We access the patients. How can we ensure the prescriptions are picked up by the patient? Again, we have the patient's information. When they drop it off, we call them. We let them know it's ready. There's techniques in place for that. But the big one here, how do we make sure the patient arrives at the pharmacy? And there's no real way to ensure a patient is going to fill their prescription. We can't force them to go to the pharmacy, but what we can do is we can increase their access to pharmacists and increase their access to pick it up. So really, if we start working this backwards, and the biggest gap right there is that 50 to 70%, how do we improve that? To me, it's access to a pharmacist and to a pharmacy. And this is actually shown in a study through Kaiser. They had a discharge rate of non-adherence at about 38%. So 38% of their patients would leave their hospital and never fill their prescription. Well, they decided, we're going to start providing this on site and measure how much the non-adherence drops. And in that study, the non-adherence dropped to 5%. So 95% of patients filled their initial prescriptions when it was offered at that point of care. And that you can kind of see is the exact, we're talking about that leaky bucket. That's the exact issue right there being resolved. And the key there is who's resolving it. It's the pharmacist. It's the access to the pharmacist. Talking about access in rural areas, how does telepharmacy improve access to pharmacists in rural areas? 77% of rural counties are considered health professional shortage areas. And we talked about this earlier, the number of independent pharmacies that closed, 946 closed between 2011 to 2015. And those are really alarming numbers. As these independent pharmacies close and independent pharmacists are leaving their sites, it's leaving patients without access to a pharmacist. And it's kind of a reciprocal effect. As a pharmacy leaves, physician's assistants are having trouble staying in business, or doctors are having trouble staying in business in town, because patients in the rural towns are going to drive into town to go see the doctor because they can get their prescription filled in that town. Not only that, they'll end up doing their grocery shopping outside of town every time they leave town. So it's kind of a problem that continues to build up and extrapolates, and really can be devastating to a rural town. And you think it's as small as losing a pharmacy, but it's not. You're losing jobs, you're losing income, you're losing people moving to your town. So we like to talk about a couple examples. This right here is Ziering, Iowa. This is a company who practices telepharmacy in Iowa. And you can kind of see the side of the building over there on the left. That's actually the physician's assistant's office. And we were talking about Ziering, Iowa earlier today, and the pharmacist there was saying when the physician's assistant came to that town and opened her office, she had 3 goals. One of them was to get a pharmacy to come to town. One of them was to open her own practice in the first place, and the second one was to grow, or the third one was to grow her practice. And she was able to achieve all of those. And number one was by getting that telepharmacy into the town. But I think what really, once she got that telepharmacy into the town, her practice really soared, and she had to hire a second physician's assistant because she had nonstop business. So she's over the moon excited about having a telepharmacy. The patients in that town are excited about having access to a pharmacy. And you think about the healthcare that's being provided in the town, it's really solved that problem. She goes to the extent that she has a tablet in her office. And let's say a patient comes in and they failed their statin therapy. They'll bring the pharmacist up on that tablet and have a conversation with them and say, hey, we've tried simvastatin. The patient's not really getting any effect. What do you recommend we switch to? So it's really kind of made a health hub in that community. The patients are really loving it. And not only that, if you think about patients buying an over-the-counter product in a rural town, they'll pick it up. Generally, it's in the grocery store. They pick it up and buy it, and they have no one to talk to about, does this interact with anything I'm taking? And telepharmacy really helps with that as well, by having that pharmacist available in the town. The patient can now walk in and say, hey, can I take this aspirin with my Coumadin? Is that really a problem? So it helps on multiple levels. And this is a picture of Brett Barker, who's actually the director of pharmacy for New Cara. And that's really all you need for a telepharmacy in these towns. You can see the full pharmacy behind him, but he's standing in front of the tablet that the patients talk to the pharmacist and the phone that they use to make sure that it's a secure conversation. Here's another image. This is State Center, Iowa. This is the grand opening. I like this picture because you can really see how excited the people are that they're actually getting a pharmacy. But this one's even better. We're talking about development for these rural towns. There's a lot of buildings in these towns, a lot of sites where the buildings are starting to fall apart and nobody's really caring for them. You can see on the top here, the before image is the State Center. The front doesn't look too bad, but when you look at the inside, it was just destroyed. They had kept the front cleaned up, but they closed those blinds so you couldn't really see the inside. But it went through a full overhaul when they wanted to put the telepharmacy in there. And you can see it's actually a really gorgeous site. Multiple over-the-counter products are now available to the patients, greeting cards, all the little knickknacks that you think of when you think of your mom and pop pharmacy. And not only that, it's providing that access to a pharmacist. We like this quote from Angela Falk: the telepharmacy helps create a new patient-pharmacist relationship that wasn't before possible. I know I mentioned that North Dakota study before, and I keep talking about how telepharmacy is creating jobs. Out of that North Dakota study, it showed that 80 to 100 new jobs were created in North Dakota between 2003 and 2008 directly related to these telepharmacies. So it's not just the pharmacist creating 1/3 of a pharmacist's job who's able to oversee these, but we're putting technicians in these locations, cashiers in these locations. I talk to rural health associations all the time, and if you can add 3 to 5 jobs to a rural town, they're excited. 3 to 5 jobs is a lot of jobs for a town that's having issues. And it brings people into the town. And throughout 2003 to 2008, 80 to 100 of those were created in North Dakota. And we're told, anecdotally, 30 to 40 of those were pharmacist jobs. But not only that, it brought $26.5 million back into North Dakota. And if you start thinking about a lot of the prescriptions that are filled through mail order, they're leaving the state. That money is leaving the state. That sales revenue, that job revenue, every job that is brought into the community, there's employee tax or sales tax for over-the-counter items that are sold. They're all leaving these rural communities. A study at a University of Illinois showed that every telepharmacy that it's added to a rural town adds $640,000 to that local economy. So you can imagine if we can stop keeping, nothing against mail order, but if we can keep the money in our states, we can keep the jobs in our states, it'll continue to help our states grow, help our budgets. It all kind of really makes sense for those rural communities. The last point I kind of want to touch on here is that increased reach. Are there any applications for telepharmacy in urban settings? And when you hear people talk about telepharmacy, they really just think, hey, this is for rural areas. I've gone out to states before and they say, hey, we don't have any rural areas. We don't need telepharmacy in this state. And I kind of disagree with them. And Chicago, I think, is the perfect example of this. There's about 1 million residents in Chicago that live in what's considered a pharmacy desert. And the definition of pharmacy desert can kind of vary. It's just basically access to a pharmacist. And there's a study, again, that shows that 1 mile, if you have low vehicle ownership, is difficult to get to. And that's considered a pharmacy desert. So we think about Chicago and you think about everybody can get around everywhere they want, but think about patients with low socioeconomic status. They have no availability of reliable transportation. They may even have language barriers living in these towns. So if they're walking to their pharmacy and it's the middle of winter or even the middle of summer and it's over 1 mile, I don't think a lot of them with healthcare conditions are going to be able to make that trek. So how can we provide access to a pharmacist for these patients? And that's really the perfect example of using telepharmacy. We have patients in the south side of Chicago who are opening telepharmacies, and they're extremely successful because now patients are going to be adherent with their medications, increasing that overall pool of prescriptions that are being filled, if we look back to that leaky bucket slide, and overall increasing the patient outcome in healthcare. When patients were asked, 75% of them would prefer to fill their prescriptions at their point of care if given the choice. And another thing that kind of comes up with this that's really a big deal to me in urban communities is HIV clinics. There's patients who will go through their HIV clinic. I can imagine, I guess I can't imagine the stress of that first meeting when you first time you go in, you find out you have HIV. They give you this list of medication that you're going to start taking, or one medication that has them all in there, but just the stress and the stigma behind it. And then you get handed a prescription and say, hey, go somewhere and get this filled. Just the whirlwind of emotions that you must be going through. And the number one predictor of outcome for patients with HIV is their adherence to their medication. So think about the difference in care if a patient could talk to an HIV specialized residency trained pharmacist. No offense again at the big box retailers. I used to work at a big box chain, but I guarantee you I was not educated on counseling a patient on HIV medication. Let's let these clinics have an HIV specialized telepharmacist available for their patients when they get discharged, so they can leave with that first fill of their medication. A pharmacist can go over everything they possibly could need for that medication and improve their overall therapy, their outcome, their likeliness to take the medication, address any kind of signs and symptoms or side effects that they need to worry about. To me, it just makes a lot more sense. And if it would be great if we could put a pharmacist in these locations, but if they're seeing 20 patients a day, it just doesn't make financial sense, and that's the reason it's not happening now. Better education for the patients plus better access to a pharmacist equals better outcomes. A patient visits a pharmacist 35 times a year. Think about how many times they visit their primary care physician, it's 4. How many times they visit their other healthcare providers, any of them, dentists, dermatologists, whatever you think about there, 9. The pharmacist has the biggest impact to be able to make a difference in a patient's life. So why can't we make pharmacists more accessible for these patients to continue to improve that therapy? Here's another example. I like to show pictures. This is the University of Wisconsin, their pediatric clinic. And they were having an issue with patients, mothers that would end up coming in the middle of the night because the clinic was open late. They'd get a prescription for an antibiotic and there was no pharmacy to fill it at. They didn't have a lot of volume at night, but you come in at, say, 9, 10 o'clock at night and give somebody a amoxicillin suspension, and then they have to wait till 9 a.m. the next morning to fill it. It just didn't really, the therapy wasn't really there. So they added a telepharmacy to this clinic. And you can see it was added over here in this little corner, and they just have that tablet with the phone, but they have access to a pharmacist who's helping all of their clinics at the same time. They do it out of their main facility. But now patients are able to be discharged from this pediatric clinic and start their therapy immediately. And it's proven to have great outcomes for their patients. I kind of flew through all that. I'm going to hit on some common questions. Usually these are questions that we get when we go to state boards, when we do this presentation. Try and answer as many of them as we can, and then we'll kind of glide into questions as well. But what kind of telepharmacy is there? I talked about the remote dispensing, and there's multiple choices out there for providing telepharmacy. There's 2 main categories. There's hardware-based solutions and software-based solutions. This slide really shows the hardware-based solutions. So the companies that are out there are Script Pro. They're the ones who do the U.S. Navy. Medavail, they're affiliated with Walgreens. Polycom, Cisco, they do that live video. These are great solutions. I've seen that Medavail robot inside and out, and I'll be honest with you, I'm extremely impressed. It does have a limited formulary, but it's a pretty cool machine. The issues with these, they're fairly expensive to start up, but they are pretty impressive. And they can provide that ability. I know they're putting a lot of those Medavail clinics in Walgreens to allow 24-hour coverage. They're looking at emergency rooms to be able to discharge medications with these robots. At the same time, there's also software-based solutions, which offer at a much, much reduced cost. You do have the overhead of having a pharmacy technician on site to be able to actually talk to a patient, which is my preferred method. But it's a much, much more reduced cost with software. It interacts with your pharmacy management software. There's Skype, there's Zoom, FaceTime, and then Telepharm as well. One of the only concerns I have is make sure that the solution you use for this is HIPAA compliant when you're providing these services. But telepharmacy really does allow that ability for a pharmacist to be anywhere you could possibly think of. And I know I talked about that 24-hour clinic and providing that access, the HIV clinic. You can put telepharmacy in a Coumadin clinic to provide access to a pharmacist there. Workload balancing between stores. Some stores may be busy, other stores are not. We hit on the urban areas. We hit on specialists. We talked about hospitals being able to discharge patients with medication. I kind of get excited because usually when we give this presentation, somebody comes up with some new idea of a place that they've always wanted to be able to have a pharmacist and weren't able to do it before. We had a customer one time during a presentation who said, what about bedside delivery? can you use telepharmacy for that? And yeah, actually that makes a lot of sense. So they're trying to give patients tablets on their way as they're getting discharged from the hospital, where they have a face-to-face consultation with a pharmacist who goes through every one of the medications they're getting discharged with, potential side effects, and then they get their medication at bedside before they get discharged. I can only imagine the difference in their therapy for that. I talked about load balancing. I know we touch over that, and a lot of people kind of wonder what load balancing really is. It's when the best way to describe it, the new prescription arrives at pharmacy A. You have a pharmacy A and pharmacy B. And I'm guessing this image is of telepharmacy, not load balancing. I'm sorry. That's me taking over a presentation. I apologize. This is really how a telepharmacy works. And this is the brick and mortar pharmacy, is that pharmacy A with a pharmacy technician on site. And then that pharmacy B is where that host pharmacist is. So what happens, the patient at telepharmacy A walks in, hands the prescription to the technician. The technician enters all the data into the system. It goes back to that pharmacy B for a check. The pharmacist at pharmacy B looks at it and says, yes, that's the right drug, that's the right therapy, and gives them that virtual thumbs up back to that technician at store A. The pharmacist who did that is recorded on site. So everybody who touches it throughout this process, their initials are recorded. The technician then gets that okay, and they start filling the prescription. As they're filling the prescription, they take images of every step of the process. Those images get sent back to the pharmacist again at pharmacy B. The pharmacist reviews those images. If everything looks good to the pharmacist, again, they give them that virtual thumbs up. And then the technician is able to bag that prescription. And this is really where the big question is what prevents that technician from being able to sell the prescription without the pharmacist doing the consultation. And we have a hard halt in our system that does not allow the prescription to be sold. So the technician will pick it up, they'll scan it when the patient comes to pick it up, and then the technician will guide the patient over to the tablet to do that consultation with the pharmacist. The pharmacist at pharmacist B that then does their consultation, and then the prescription is released for the patient to pick up. So you can see it's really the whole process of filling a prescription that a general pharmacy does, and that's why we really like to refer to it as remote pharmacy dispensing more than telepharmacy, because it's really the pharmacist is overseeing the technician remotely as if they would if they were on site. Frequently asked questions we get, how do you ensure fill accuracy? We do barcode verification. I talked about that imaging, where you image each step of the process. We've shown that fill accuracy is actually increased in this because of the barcode verification, because of the multiple steps in the process where everything is checked. I probably shouldn't talk about this, and this is why they don't have me doing these presentations and they have Greg doing them. We have future iterations of our software coming out where you can pour tablets in front of a camera. The camera can read the imprint of the tablet and then measure the tablet and measure every other tablet in front of the camera and tell you how many of them there are and what tablet they are. So, for instance, you could pour a bunch of tablets out there. It'll say, 10 lisinopril, 10 milligrams, 20 lisinopril, 20 milligrams, just because of reading the imprints and measuring the tablets. And it does that in a fraction of a second. Staff and location safety. How do you ensure a patient is safe at a telepharmacy? Or how do you ensure an employee is safe at a telepharmacy? They often worry about that. To me, if somebody wants to rob a pharmacy, they're going to rob a pharmacy, whether it doesn't matter if a pharmacist is on site or not. You can't really, all these telepharmacies, we generally recommend you have full coverage with HD cameras, so everything going on is recorded. And we also recommend having a panic button in there. When we talk about these rural pharmacies or these low access areas, generally the patients kind of protect their pharmacy. Patients really want to keep their prescriptions on site, and they want to keep that pharmacy in place, and they kind of keep an eye out for it. But they also have very limited formularies. We talked about some of these stores that are doing 20 prescriptions a day, 30 a day. You're not going to have the volume that really makes it appealing to somebody to try and break in. Will someone eventually probably break into a telepharmacy? I would imagine yes, but they are still breaking into traditional pharmacies as well. Diversion is another big one we get. People always ask us, how do you prevent diversion in these telepharmacies? On-site pharmacist checks. Technology has gotten to the point that there's perpetual inventory that lines up quantity ordered versus quantity dispensed, so you should be able to tell exactly how much is on stock. There's cameras in all areas. This is another one where I say there's good pharmacists and there's bad pharmacists, just like there's good technicians and there's bad technicians. You don't have your bad technicians working in a telepharmacy. You want to have the top technicians available in your telepharmacy. This is really an advanced role for a pharmacy technician. Usually requires some kind of advanced training. Generally, these technicians are certified. They have experience working in other pharmacies. And this is really a career path for them to help keep them interested in moving forward. So diversion really doesn't happen at these locations because it is the best technician of the best technician. Internet outage, that comes out as well a lot. What do you do if the internet goes out in your telepharmacy? The same thing you do in a traditional pharmacy nowadays. Nobody really does typewriters anymore. If the internet goes out, the pharmacy generally shuts down, and that's the same thing about a telepharmacy. What's really cool is the telepharmacy, and you think about, you go into these rural towns and you can do FaceTime on your cell phone. You can actually operate our software on 3G if you had to. So theoretically, it's kind of redundant. You're able to have a redundancy in there to keep it open. But overall, the big points we're going to hit on, I know I kind of rambled a little bit and went all over the place, but telepharmacy utilizes technology to improve patient adherence. Telepharmacy allows that pharmacist to have access in these rural areas. And telepharmacy is allowing us to increase the pharmacist outreach and increase patient outcomes through access to a pharmacist. I talked really fast. I apologize, but I wanted to leave plenty of time for questions if you guys had any.
Thank you so much, Adam, for taking over. I apologize for any issues with us since you're using my remote slides. Anytime I move my mouse, you lost the slide.
Oh, no worries.
Let's go ahead and we'll go through these last couple of things here, and I'm sure there's lots of questions. So everyone on the call or on the webinar, now is your chance. Go ahead and start typing away in the Q&A box, and we will take those questions. A lot of great information here. I really appreciate you guys talking about this. Ever since I first learned about telepharm a couple of years ago, I'm fascinated by the idea of using technology to deliver prescriptions, and I think it's so important in rural areas in particular. So our next webinar in the series is going to be January 19th, and we'll be focusing on funding do's and don'ts. It will be the Heartland Telehealth Resource Center's chance to host this particular webinar series. I am going to go ahead and put into the chat function, I'm going to open that up as well and put the survey link in here. We appreciate feedback. All of the 14 telehealth resource centers are grant funded, so we always like to be able to share information with our funders and talk about what we've had going on. So I see some questions here starting to come up in the chat.
Yeah.
Any of our presenters, feel free to go ahead.
And my internet, I think, is working again here, Becky. I apologize again for that. But I can take the first question up here at the top. And how does Telepharm compare to the offerings of Pipeline or Perceptimed? And I'm not familiar with Perceptimed, but I know Pipeline very well. We're very, very familiar with them. They would be on the inpatient telepharmacy side of things. So their primary offering is going to be the remote order entry review in the inpatient setting. Whereas Telepharm and the retail telepharmacy that we're talking about is on the outpatient setting. So it's going to be for those just actually dispensing to the patients, so they can take those home at discharge or wherever else, in a regular retail pharmacy. The second question here, I'm definitely going to have Adam answer. So Adam, you want to take that one? It says, what states is this legal?
That's a challenging question. Maybe we can go back to that slide that we had out. There's about, I think, 27 states who talk about telepharmacy in their rules and regulations, but it really varies across the board. If you have a specific state, I can definitely go into more detail about that. And really every day, a new state is looking at new ways to add regulations and rules to be able to allow this to work. But I would say most of the West Coast states have something in place. It's starting to move into the East Coast. But if you do have questions about a specific state, please let me know, and I'm happy to answer it. It looks like Rusty just said Georgia. Lucky for you, Georgia is not one of the states that allows telepharmacy. Well, not lucky. Unfortunately, the South has been a little hesitant to embracing technology as an answer. We're working in Georgia about getting them to maybe at least address it. I know Alabama has showed some interest. I think it would be extremely useful in Alabama and Georgia, but as of today, it's not legal in those states. If you are interested in being a champion in that state, definitely please reach out to me.
And just to tag on to that with the Georgia comment, it's surprising. It's been surprising to us that Georgia has such a well-developed telehealth and telemedicine network throughout the state, and they haven't really addressed the telepharmacy side of things yet. But like Adam said, we're starting to engage with them and would love to address that with them. So what type of hardware are we using in the telepharmacies, tablet, phone, software? It really depends. If you're asking, so a general response would be, if you go with a hardware solution, most of those providers are going to provide that hardware for you to use. So if you were going to go with like a Cisco or a Polycom system, you'd buy their hardware, and that would be the basis for the system, and how you would then operate and manage that telepharmacy site. Some of the newer solutions, they're in the software-based solutions, they're obviously moving away from the hardware component. So I'd say a general rule would be most of them will work on almost any device, and as long as it can load that software. Specific answer from Telepharm and what we do, we're browser-based, and so we can be used on a tablet, and it's all cloud-based software. So we'll just we can actually connect into the existing hardware that's there on site, the computers that are there on site, and have maybe a couple of extra components that we might put in hardware-wise just to help facilitate the process a little bit better. But most of our core features and functionality are based in the cloud. The next one here, what do you use to take pics of the prescription filling process by the techs? Any experience with ScriptPro? So the pictures with our system are taken with an HD camera that faces down on the counter. The technician can just easily use that and take pictures to make it very, very simple and easy process. The feedback we get from the technicians is that, when they first start doing it, they need to learn a new workflow, and it's a little bit of a challenge for them to learn how to get everything lined up and actually take the pictures. But after about a week, they get a flow down and figure out how they're going to image these prescriptions, and it's very, very easy. And then those images are immediately loaded into our software system, and then we bundle those up and send them all together in one package over to the pharmacist for verification. Experience with ScriptPro, definitely. They are the system that right now that's being used by the U.S. Navy to provide the telepharmacy services on that very, very large, expansive network. So they have a lot of experience in the government side of things. There are a few other installations throughout the U.S. that we're aware of that ScriptPro is being used. But again, theirs is they do a software component to theirs. So they are a very close competitor to what we're doing. But they are a little bit different and also have some hardware that they provide as part of their solution. So one that you should definitely look at if you're considering any kind of telepharmacy solution. They would be one of the other leaders in the industry to look at. Next one up here. What is the best way for a patient in a remote location without a nearby pharmacy to receive medications after a provider-patient telehealth encounter? Adam, I might, as a pharmacist, I might toss that one over to you and see what your thoughts are.
I'm just rereading it to make sure I fully understand it before I answer it for you, Corey. Nearby pharmacy. So, in my opinion, the best way for them to receive the medications is from a telepharmacy solution on site. I think that's kind of a challenge, and that's really the big challenge with telehealth right now. I'm very familiar with the battle that's going on in Texas with telehealth, and one of the problems they're having is how do you ensure the validity of a prescription provided by someone with just a telemedicine consultation or meeting, and where can you get these prescriptions filled? And some pharmacists are refusing to fill them, and what constitutes a good and safe prescription. In my opinion, and the best answer to that, the patient is in a remote location. We need to do whatever we can to make sure they're able to get their medications after this meeting. I see nothing wrong with having a telepharmacy at that location as well. And we've had discussions with people who want to do a full telehealth suite where there are operators there. Maybe one person who works as a pharmacy technician and as a medical assistant. They hold the cameras for the telehealth consultation. They'll get the prescription and they basically enter all the data for the telepharmacy consultation and count the prescription and dispense it. So in my opinion, that would definitely be the best way, because that's definitely a huge problem. It's not going to be legal in every state. Hopefully it is at some point. But again, I think at some point we'll have drone delivery of prescriptions as well. So that might be a solution too.
And then I think that next one, you're probably going to want to take that one too, Adam, as it's a licensing question.
If the pharmacist is in Florida and is doing telepharmacy for Colorado, is it necessary to have the license of Colorado? Well, that's an interesting question as well. And that's where it varies across the states. You look at Illinois' language. Illinois, you can be doing telepharmacy from anywhere. So to answer your question, and I'm just going to change the states here, if you lived in Missouri and you wanted to open a telepharmacy in Illinois, you would have to have a telepharmacy. You would have to have a pharmacist license, and the pharmacy would have to be registered as a non-resident pharmacy, but you could do telepharmacy to Illinois from Missouri. To the direct question, if the pharmacist is in Florida and doing telepharmacy for Colorado, is it necessary to have a license of Colorado? Currently, Colorado allows telepharmacy. I don't know the answer if it could be allowed at a state. I can find out that answer if you want to contact us directly and look into it. Colorado is a challenging one because you have to be 20 miles from another pharmacy, and you also can't store drugs on site at a telepharmacy in Colorado. So there's not very many telepharmacies in Colorado right now. We're working on getting those regulations fixed, so it's much more friendly. But it would really, long story short, it would vary whether the pharmacist has to be in state. Some states even require the pharmacist to be located in state, and they wouldn't be able to do it from Florida. But I would say they do probably all have to be licensed in the state.
Yeah, great questions. This next one, who are your competitors and what sets Telepharm apart from them? Again, I think we mentioned that, and if Becky wanted to flip back, otherwise we can share the deck with you afterwards. And there's those other companies on there that would be providing both software and hardware solutions. So those would be considered in the same competitive area that we are. But probably the closest competitor is the Script Pro. They've been around for the longest and have the largest installation, and they also have a telepharmacy specific solution, which is what their hardware and software together are. They provide something that is targeted towards telepharmacy. What really sets Telepharm apart is that we're one of the only telepharmacy specific solutions, and we're the only one that is a software. Cloud-based software that's specifically built for telepharmacy. And one of the biggest things that we've gotten feedback from our customers that we can bring to this scenario is our workflow management, and the way that Telepharm works by doing things asynchronously and doing store and forward for the verification side of the prescription filling process allows the telepharmacy technician to work at their own pace, and the pharmacist at the managing pharmacy to juggle all the competing the things that are competing for his attention in the pharmacy during the day. So the other consults, the phone calls, the other prescriptions that he's filling, and so it allows them to work independently but still sync up together and make sure that those prescriptions are being verified and that patients are getting counseled in a very efficient manner. So that's the largest thing that sets us apart. We also just make it very, very easy to get the installation up and running, and we're constantly adding new features in. I think Adam mentioned before we have we have some hard halts that are built in, and we're adding in more and more safety features all the time as we talk to more state boards, and as our company grows. We're able to quickly, because we are software based, we are able to quickly, determine what's a great solution to be able to put a barcode check into place. So I know just recently we launched barcode checks for each individual user that are generated daily. So we can, any action that's taken within the system, they need to scan their badge or, scan a barcode in order to submit or do anything. And so that way we're just, again, another step, another redundant safety check in there, that's going to ensure the safety of the patients and that the whole installation is going to run smoothly without any errors. I don't know if you have anything else, Adam, that you would say, because I know I can tell you that Adam has told me time and time again that what attracted him originally to Telepharm is that he saw our product, or he saw our software at an event. I think it was at APHA, and he immediately saw it and was very, very intrigued by it. So I'll kind of let him tell you a little bit there.
I really want to jump in and kind of do a Donald Trump impression about how we're the best and we're amazing, but I don't know how that would be accepted.
But not a sales presentation, guys.
Yeah, I'm kidding. I'm happy to answer any specific questions about our product offline, though, if you guys want to reach out.
Yeah, and one of the earlier questions was about the slides. We've got everybody's email from the registration, and we'll get the slides out, and I'll try and get the link posted, the recording posted to the YouTube channel. We'll get that out within the next 24 hours. All right. Any
Appreciate that, Becky. I just want to take a quick second to, I don't know if you guys heard me at the beginning, but shout out to the telehealth resource centers. You guys have been really great for us to work with. We appreciate you giving us this opportunity today. And I encourage anybody who's on the call who hasn't really leveraged the resource centers across she said there's 14 of them across the U.S. If you haven't leveraged them, please do that. They're a great resource, helps to network and connect you. And they definitely know they're a great place and center of knowledge for everything telehealth related.
Well, thanks, Greg. I appreciate that. All right. Hearing no further questions, seeing nothing else, thank you all for joining us today, and have a happy holidays and Happy New Year.